Wernicke's Aphasia, The Art of Word Salad by Felicity Garten. So let's start with talking about what is aphasia. Aphasia is a neurological disorder that affects the understanding and the ability to express speech. Often you get this from a stroke, brain injury, and it's also a common side effect of the neurodegenerative disease Alzheimer's. So this is more common in our older generations and something that tends to happen later in life. So, what exactly is happening in your brain? There are five different things that could be happening that is causing you to have aphasia. The most common is neuron death. Neuron death can happen directly from an injury or the stroke. In some cases, your brain will undergo the lack of oxygen to the cells, therefore, also leading to cell death. Second is damage to axons. Damage to axons can prevent neurons from communicating, which can lead to more death of cells, basically. Damage to neurotransmitters. Neurotransmitters are the chemicals that create neural communication. And if you have a problem with these, it is going to cause them to not be able to signal between neurons. Therefore, your brain will not be able to produce or engage in language quite correctly. Inflammation and swelling is also just a side effect, kind of, not a main reason, but it creates pressure in the brain, therefore creating more tissue death as a result. Lastly, the loss of synaptic connections, often damage to the synaptic gaps can cause a weakened or destroyed connection between neurons. So why did I pick Wernicke's? Wernicke's area is a region in the left side of the brain, and it is on your superior temporal gyrus that controls the comprehension of speech and spoken language. So for symptoms, a lot of grammatically incorrect sentences, using fake words, impaired comprehensibility, not understanding errors in language, word substitution. It can also affect vision, and lastly, it's finding difficulty finding words. This is often, if you're having a conversation with someone who has this, they will be using words that directly are in correlation with the subject, but not really creating full sentences that are comprehensible. Lastly is patient care. There's honestly no proven rehabilitation for patient care, but a lot of people will seek situational therapies to help manage with, pronunciation and understanding speech so that they can communicate properly. Table of contents. So we're going to go over pathophysiology, which is explaining the functional and biochemical changes that are associated with the disease. Risk factors, which is pretty self-explanatory, same with symptoms and complications. And lastly, special considerations, things that just make Wernicke's aphasia unique and something that you need to look into. Pathophysiology. So first on the functional side, you could find damage to Wernicke's area, which is those things that we're talking about with injury or stroke. It's just killing off the dead brain cells in there. Impaired somatic processing. So people will often lack the ability to link meaning to words and sentences. This could be a problem because they will have what's called word salad, and it's just kind of a jumble of words that don't really correlate or make sense together. Auditory verbal processing. This is effective understanding read or spoken instructions, which can be dangerous for our older crowd because if they are living alone or they're living with other people and they're trying to understand instructions to help save their life, they might not be able to do that. And lastly, connection to other brain regions. If the death of cell continues to affect other areas, it could cause more problems. For example, the cerebellum is controlling a person's balance. So if that region continues to have problems, then their balance could cause more injury, things like that. On the biochemical side, we have neurotransmitter imbalances. So, for example, I have glutamate and GABA, which they are neurotransmitters that kind of just affect speech. And if you're not getting those properly fired throughout your brain, then you're not going to be able to communicate properly. Disruption of language. The damage to the arcuate fasciculus and angular gyrus can cause death of cells between Broca's area and Wernicke's area, which is creating more difficulty in speech because you're having two areas now affected. Cerebral blood flow. So if you are having blood flow problems, this could once again cause more nerve damage or death of cells. And then lastly, neural growth and synaptic plasticity, which in our older crowd, we won't really be seeing this because a lot of our older folks won't have the ability for their brain to basically reorganize and rewire their connections. Risk factors. So we have two main risk factors, one being self injury, obviously. Um, a side effect, people can have problems with their vestibular system and cerebellum. So, once again, balance problems, dizziness, all of that. Also, many people fall into a state of self isolation and depression because they just feel that no one understands them, and this can actually lead to self harm in some cases. Miscommunications, like talked about earlier, if someone needs to have explicit instructions, let's say for a medicine they need to take every day and they don't understand that, they could be not taking that medicine, or if a doctor's office says something, it could be translated in a wrong way to the next person, and it just can lead to some inappropriate or dangerous situations. Symptoms, fluent and nonsensical speech. Obviously, like we were saying, that word salad, that ungrammatical sentences, difficulty understanding. They may not be able to repeat you, or they need you to repeat a couple of times before they catch on. Difficulty repeating and naming. So a lot of objects will lose like their name or their meaning. So they will create either their own name or they just won't be able to find the word. Reading, writing, and numerical challenges. They lose their ability to operate these at a proper level for their age. And lastly, vision challenges. Wernicke's area is close to the place that affects vision in your brain. So some people may experience some vision loss or even possibly full vision loss. Complications. So we have four main complications that can be setbacks in these patients' lives: confusion, frustration, isolation, and depression. They're all kind of linking together, but a state of confusion all the time is lacking reality, and it can make people not be able to do complete tasks for a job or even basic things that just like make people people. Second would be frustration. It could be frustrating not being able to communicate your own feelings, and it could lead to lashing out and possible self isolation, which leads us into isolation. And of like a deaf person, if you cannot have proper support for deaf community, then you feel that nobody is also understanding you. You can self isolate and be depressed, which is leading to our last one, which is depression. And as we talked about, a lot of people go into that dark place and possibly even leading into self harm. Special considerations, we have three main ones. The diagnosis is kind of hard to diagnose unless you're going into a doctor's office for an MRI, CT, or PET scan. So, unlike a lot of things that a doctor could go through, sometimes it takes like days and possibly even months to get in to really understand what's wrong with you. Second is our population. This is predominantly in older adults, but it's not technically a neurodegenerative disease unless it's linked to something like Alzheimer's. So it's just a rare case of a disease that just so happens to be only affecting our older crowds. Misunderstandings. It's a huge stigma that people who have this are incapable of living normal lives, and that they also are not that smart, which can be really harmful for this type of demographic because they will just feel constantly upset and maybe not even wanting to continue on. Prognosis. So recovery potential is basically based off of extent of brain damage, which is pretty self-explanatory: how bad it is, where it is in the brain, how often you're using that area of the brain. Age and health, for obvious reasons, both age and general health is just going to be able to affect your bounce back. And then timing and support. If you do not have early intervention, it can be super difficult to recover fully. And if you also do not have people that are going to support you, then it can also be hard to be in a healthy mindset. Long-term outlook. So a lot of people have a progressive decline, which is pretty difficult, especially if you're in a if you have another neurodegenerative disease that you coexist with. Um, and then supportive care, you let the patient is willing to continue, because of if they're not willing to continue because they don't have proper care, it can be pretty hard to um, have a positive outlook. Quality of life, which is pretty self-explanatory. They're needing to be in these support groups and maintaining engagement in things that they just love to make them feel like their old selves. Lastly, communication challenges. For obvious reasons, they are communicating very differently than most people. So they're going to need to have a caregiver with them who can help them until death, basically, to do simple tasks. and also social isolation, which we've talked about throughout this presentation. This is just a statistic pie chart of what likelihood someone is to pick these treatment options first. So 36% of people say that their first treatment option is just speech language therapy, which is super good. And then the second one is cognitive rehabilitation, which is in just rehabilitating, rewiring that brain. The third and fourth would be 16%, both of them, which is family and caregiving, and then also psychological therapies and counseling. The rest are kind of smaller and less important, but we just have a range of things that people can go through to rehabilitate their brain. And this is my works cited. Thank you so much for listening, and that's my presentation.